Hey everyone, it's Dr. John here. In this video, we're going to break down the top 12 visible signs of diabetes that you can spot early. We're talking about those subtle clues your body might be sending you, things you can actually see that could indicate something's off with your blood sugar. Early detection is key to managing this condition and preventing severe health issues. This video isn't just important for you, it could help someone you care about identify symptoms before it's too late. So let's dive into these signs, explain why they happen and how they might show up in real life. Remember, this video is for informational purposes only and not a substitute for professional medical advice. Let's talk about the first sign: excessive thirst, also known as polydipsia. We all get thirsty, especially after a workout or on a hot day, but if you're constantly reaching for your water bottle, it could be a sign your body is trying to tell you something. When your blood sugar is high, it throws your kidneys into overdrive, pulling water from other parts of your body, leaving you dehydrated. That feeling of dehydration, that's your body screaming for more fluids, hence the excessive thirst. It's important to note that excessive thirst alone doesn't mean you have diabetes, but it's definitely a red flag to pay attention to. Now, let's talk about frequent urination, or polyuria, which often goes hand in hand with excessive thirst. Your kidneys are like a plumbing system, and urine is the way they flush out waste products, including excess glucose. When your blood sugar is high, your kidneys produce more urine to carry that sugar out of your body. This leads to more frequent trips to the bathroom, especially at night. It's normal to urinate more frequently if you're drinking a lot of fluids. But if you're noticing a significant increase in bathroom breaks, even if you haven't increased your fluid intake, that's something to pay attention to. Again, it's about noticing changes in your body and patterns that seem out of the ordinary. Losing weight without trying might sound like a dream come true for some. But when it happens suddenly or without a clear reason, it's a major red flag, especially when it comes to diabetes. In diabetes, your body either doesn't produce enough insulin or your cells become resistant to insulin. When this happens, your body can't use glucose effectively for energy, so it starts breaking down muscle and fat stores for fuel instead. This leads to weight loss, even if you haven't made any changes to your diet or exercise routine. So, if you're noticing the numbers on the scale dropping without any explanation, don't just brush it off. It's crucial to get checked out by a healthcare professional. Have you ever felt like you could eat a 5-course meal and still be hungry an hour later? You're not alone. Increased hunger, also known as polyphagia, is a common symptom of diabetes. In diabetes, glucose isn't getting into your cells properly due to issues with insulin. This sends a signal to your brain saying, hey, we need more fuel. Your brain then triggers the release of hormones that increase your appetite. It's like your body is stuck in a constant state of craving energy because it can't access the glucose that's readily available in your bloodstream. Blurry or fluctuating vision is a symptom many people brush off, attributing it to eye strain from staring at screens all day or simply getting older. High blood sugar levels can wreak havoc on your eyes, specifically the lenses. When your blood sugar is high, it disrupts the fluid balance in your eyes, causing the lenses to swell and change shape. This swelling makes it difficult for your eyes to focus properly, leading to blurry vision. It's like trying to take a picture with a camera lens that keeps changing shape. You're not going to get a clear image. So, if you're experiencing blurry vision, it's worth getting checked out. Have you noticed that small cuts or wounds on your skin seem to take forever to heal? This is a classic symptom of diabetes. High blood sugar levels can significantly impair your body's natural healing process. High blood sugar damages blood vessels, reducing blood flow to the affected area, making it harder for your body to deliver the necessary resources for healing. High blood sugar weakens your immune system, making it more difficult for your body to fight off infections that can delay healing. So if you're noticing that even minor wounds are taking an unusually long time to heal, it's crucial to see a healthcare professional. Don't ignore these signs. Let's talk about a condition called diabetic neuropathy, a common complication of diabetes that affects your nerves. Neuropathy often starts as a tingling or numb sensation in your fingers, toes, hands, or feet. This happens because prolonged exposure to high blood sugar damages the small blood vessels that supply nutrients and oxygen to your nerves. Without proper blood flow, your nerves can't function properly, leading to those uncomfortable and sometimes painful sensations. Imagine your nerves are like electrical wires. When those wires are damaged, they can't transmit signals effectively, leading to a disruption in communication between your brain and the rest of your body. That's what's happening with diabetic neuropathy. Have you ever noticed dark, velvety patches of skin on your neck? Have you ever noticed dark, velvety patches of skin on your armpits? Have you ever noticed dark, velvety patches of skin on your groin? This condition is called Acanthosis nigricans. While it's often harmless, it can be an early warning sign of insulin resistance, which is closely linked to type 2 diabetes. Insulin resistance occurs when your cells don't respond properly to insulin, forcing your pancreas to produce more and more insulin. Over time, this constant overproduction of insulin can lead to a buildup of insulin in your blood, which can trigger changes in skin cells, leading to Acanthosis nigricans. So if you notice these dark patches, it's worth getting checked out. Early detection can make a big difference. We all feel tired sometimes, especially after a long day or a poor night's sleep. But if you're experiencing chronic, unrelenting fatigue that never seems to go away, it could be a sign of diabetes. In diabetes, your body either doesn't produce enough insulin or your cells become resistant to it. As a result, glucose can't enter your cells efficiently, leaving them starved for energy. That's what's happening with diabetes-related fatigue. Your cells aren't getting the fuel they need, so your body is running on empty, leaving you feeling drained and exhausted. If you're finding yourself battling one infection after another, it could be a sign that your blood sugar is out of whack. High blood sugar creates a breeding ground for bacteria and fungi, the culprits behind many infections. Sugar feeds bacteria and fungi, allowing them to multiply rapidly. High blood sugar weakens your immune system, your body's natural defense mechanism against infections. So, not only are you more susceptible to infections, but your body also has a harder time fighting them off. Nobody likes dealing with dry, itchy skin. While dry skin can be caused by a variety of factors, it can also be a sign of underlying health conditions, including diabetes. High blood sugar levels can wreak havoc on your skin by drawing moisture away, leading to dehydration. Diabetes can damage the small blood vessels that supply nutrients and oxygen to your skin, impairing circulation. This reduced blood flow can further contribute to dryness and itchiness by depriving your skin of the essential nutrients it needs to stay healthy and hydrated. Let's talk about a sign of diabetes that can be a bit embarrassing but is crucial to address: bad breath, specifically a fruity or sweet odor. A fruity odor can be a red flag for a serious complication of diabetes called diabetic ketoacidosis, or DKA. DKA is a life-threatening condition that occurs when your body doesn't have enough insulin to use glucose for energy. As a result, your body starts breaking down fat for fuel, producing ketones as a byproduct. Ketones build up in your blood and urine, and when they're present in high levels, they can make your breath smell fruity or sweet. If you notice this symptom, seek medical attention immediately. Diabetes is a serious condition, but catching it early can make a world of difference. If you've noticed any of these signs in yourself or someone you know, don't ignore them. Consult a healthcare provider as soon as possible. Early diagnosis and treatment can prevent complications and help you live a healthy, fulfilling life. Thank you for watching this video. Please like, share, and subscribe for more health insights. Take care and stay healthy.